Thank you, Don. What a joy to be here, and what a joy to see such a collection and such a gathering of people who, in each of us, in our own way, were part of the quilt that came together to call us to bring this to a pass, to bring health care around. We've been working at it for a century. It's time it comes, and the celebration is there. And we've begun a journey towards that which will be ever more full and rich as time comes. Healthcare was not a political process. It was a moral decision that had to be made on behalf of this country. It was a decision about justice. Just as I firmly believe that God has no stepchildren, there are none that don't deserve the best health care that's available in this country at every time they need it. And if economics or race or culture or place where someone lives becomes a factor that determines whether or not someone should have health care, there's something wrong with the country in which that exists.
Right.
And so I'm here to give thanks. To give thanks, of course, as always, to the God that empowers and to the God that worked with the people who cast the votes. As we've already said, our legislators in Washington made the right decisions at the right times, and we thank them for that work. And we thank God for that which opens up now, the possibilities that lie before us. There are opportunities to improve, to get a more integrated healthcare system across this country and across this state. And already there's work in that direction in many areas. Our brothers and sisters of the Old Testament, the Hebrew people, understood Thanksgiving a little different than we do. They didn't quite give thanks just for what God had done, but they gave thanks for that which would happen. And so I gather here tonight with you to give thanks for that which is going to happen as well as that which is done. And for the opportunities that lay in the future, for the reality that those who do not have health insurance will have it, that houses will not be sold and have people lose their homes because of bills, that people will have the health care they need to receive the fullness of life they deserve. This is what this is about. You know, when you get right down to it, health care reform is about people. It's about you and about me and about all the other people who walk around beside us. People who cannot afford to have the health care they deserve. People who cannot find the means and a way to get what they have to live full and complete lives. People who struggle each day to put the bread on the table and make the ends meet and put a roof over their head, and when they're done with that, they simply don't have enough resources, enough money to pay for the medicine that the donut hole leaves, or to cover the doctor bill, or to take care of the operation they need, or when they do, they don't have enough money to hold on to their home at the same time. Thank God that's coming to an end. We need to say thanks for all the people and all the energy that went into this. For all the people who made the statements and shared the letters and wrote the ideas and attended rallies, and for all those who were tireless in giving forth of their energy, we need to say thank you, because it was your message and your thoughts and your ideas that made this happen. And so as I gather today, it's simply with a word of gratitude for all who in many ways helped to get us to this point, so that we might look forward to future ways in which we might ever continue to improve our quest for health care justice in this land. Thank you.